We all know that one of the hardest parts about having a pet is saying goodbye. But for pet parents, there can also be a lot of questions. Questions like, how can I give my pet the best quality of life towards the end? And how do I know when it's the right time to let them go? To find out all these answers, I'm going for a walk and a chat with Dr. Kirsten, our in-house vet here at ManyPets. So let's talk about end-of-life care for a pet. So say your pet's been diagnosed with something chronic or degenerative that you know they're not going to recover from. How would you recommend sort of making their life with as much quality as possible towards the end? How would you recommend doing that?
Sure, yeah, that's a great question. So I think, the first question in my mind and a lot of my colleagues' minds is going to be, is palliative care, is end-of-life care appropriate for this pet? Because I think the two big goals that we have are providing the best quality of life we can and not prolonging suffering. And so in some cases, we might not feel that that's appropriate. But in the cases that we do feel like that's appropriate, I think that there are a couple steps that I like to make sure that we're covering. So the first one is going to be pain relief, pain management. A lot of these chronic conditions can cause pain, but also a lot of our senior or older pets that do have a terminal illness or do have kind of end-of-life needs are going to have concurrent conditions that are painful, like arthritis. So there's a lot of really safe, really effective pain medications that we have in veterinary medicine that we can use for these patients to take care of pain, which is, I think, a big thing that we need to make sure we're not forgetting about. The second part that I think I usually think about is, are they eating? Appetite is a huge issue in a lot of these pets, particularly older cats. They are very, very picky already, let alone when they start to get sick when they get older. And so having an appetite plan for cats and dogs as well is really important. We'll utilize things that cover nausea or vomiting. We see a lot of that, and even pets that aren't actively vomiting can be nauseous. So covering nausea. The other big thing is an appetite stimulant. So I think a lot of people don't realize that we do have appetite stimulants that we can use in pets, and those work really well in a lot of cases. So making sure that we are providing things that will help them eat enough food to sustain themselves. So appetite is another one. The next thing that I think about is going to be mobility. So a lot of these guys will struggle with mobility, and so providing ways that we can help them get around safely on their own. So like for some animals, this might mean we use a sling or a cart. And if they're recumbent, we want to make sure that we are helping them get up. So if they can't stand on their own, we're helping them safely and moving them from side to side if they need to be adjusted. They may need help going to the bathroom. They may need help getting certain places that they didn't used to need help getting up. So mobility is another one. Hygiene is a big one, so particularly for those dogs and cats that struggle with mobility, we also need to be thinking about, it's very likely that they will have decreased control of their bladder or their bowels, which is not as glamorous, but it is an important component of making sure that we're keeping them clean, right? So if they do struggle with that, that's something that we like to keep in mind as well. So another few things that I think are important to think about that sometimes owners kind of hesitate is, if it's safe and if there are good options, we can still provide some physical activity for these guys. It might look more like physical therapy, short walks if they can still get around, but safe physical activity is helpful, but also mental stimulation and enrichment. We can still give these guys things to do that will provide them with some stimulation during the day. And I think that also kind of goes along with, make sure that you're doing everything that you can to include them in your daily life. We know that they're not going to be around forever, and so making sure that we're spending as much time with them as we can. Pull up their bed next to your desk while you work, take them for that short walk if you can. Anything that you can do to spend more time with them and provide some attention is going to be really nice.
So how would you advise a pet parent on knowing when it's the right time to put their pet to sleep?
It's a challenging conversation to have, but I think it's one that we as veterinarians take very seriously, and it's going to look different for every pet. I don't think that there's a formula that makes it easy for people, but some of the things that I think can help people decide, and one of the ways that I've had that I feel like is successful in helping people decide, is making a list of your pet's favorite things and the things that you love most about them. So, for example, their favorite foods, their favorite toys, their favorite games, their favorite people, their favorite times of day, qualities about them that make them special to you. So I tell people to make a list, and if you're having a hard time checking off that they still enjoy those things, or that they still feel happy and excited to see you when you get home, or they're the favorite mailman or whatever, I think if you're having a hard time checking those things off of a list, then that indicates to us that their quality of life is diminished. And for some people it might be one of those things, for some people they might need to see more of those things, but especially if the bad days or the hard days start to outweigh the good days for your pet, I think that that can help us decide that the quality of life that we once had for them is no longer there.
So I know that you've been through this as a pet owner yourself. How did you personally decide it was the right time for Jasper?
Yeah, it was a pretty humbling experience. I think it reminded me a lot of making sure that I was kind of had some grace with myself and follow the pillars that I tell my pet owners to follow. So last summer, our older golden retriever got diagnosed with really severe pancreatic cancer, and we know that the time from diagnosis to feeling like we need to say goodbye is pretty short. So I really stuck with the things that I tell my clients. You know, I made sure that we were keeping his pain under control, that we were managing his appetite. So all those drugs that I talked about, we used, and he was a very happy-go-lucky dog and also a dog that will eat anything and everything. And so when he started to just show really slight changes in his attitude and his appetite we were really struggling with his appetite. The day that this dog spit out a piece of pizza was the day that I knew that we needed to make a decision. And I get a little teary-eyed thinking about it now because it's hard. It's really hard. And we know it's hard for pet owners as well. So I think that really sticking with those pillars and making sure that I was putting his quality of life over my expectations was probably the best thing that helped us decide. Yeah.
And so, as you just said, it's such a hard decision to take. What advice would you give a pet owner that's maybe reached that point where they know that euthanasia is probably the right time,
Sure.
but they're still feeling super guilty, really bad about it?
So I think one of the things that is part of our job as being veterinarians is to reassure people that euthanasia and saying goodbye is an option when we are trying to do something that is kind for our pet. We want to relieve suffering, and we take it very seriously and we cater it towards individual pets. So not every pet's process looks quite the same. And I think that we do everything we can to make it as less stressful on the pet and the pet owner as possible. So that might include things like pain relief, sedation. Some people will use a catheter, an IV catheter, some people do not, and it really just depends on what we think is going to work best for that pet. And so it's a very peaceful process and tends to go relatively quickly. So I think that people worry that it's hard on them, and we do everything we can to make it not stressful, pain-free, and peaceful. And that's really important to us as veterinarians and pet owners. Yeah. We know that this is a really difficult process for pet owners, and like I said, we're also pet owners. And so I think it's just important for people to know that if we choose end of life or palliative care, there's lots of things that we can do to provide that good quality of life for as long as we can. But also the process of saying goodbye itself, we take that very seriously and we cater it to individual pets. So making their last days with you can be really peaceful and really special.